Welcome to the Providence Zone Tool Frequently Asked Questions video. This video is a sequel to the original Providence Zone Tool video, and parts of it assume a basic knowledge of using the Zone Tool to manage heart failure. Therefore, if you haven't seen the first movie, we recommend that you watch it before viewing this video. If you're an inpatient, you can find that movie on one of our iPads or on your inpatient TV. Just ask your nurse for help. Otherwise, you can watch it from any device at one of the following links. This video tries to answer the most frequently asked questions. If you still have additional questions after watching this video, please contact your provider. Here is the first question.
I'm always in the yellow zone. So when do you want me to call the doctor?
The yellow zone means that you are burdened with the symptoms of heart failure. One of the goals for the treatment of heart failure is to be in the green zone, where you can function in your day-to-day life without feeling limited by your symptoms. You should discuss your symptoms with your doctor to see if they are related to your heart failure and not another medical problem. Be specific when talking to your doctor, including what symptoms you're having, when they occur, and how frequently you experience them. Your doctor will want to know if you're taking all your medications as prescribed, sticking to a low-sodium diet, following a fluid restriction if previously recommended, and how much activity you're getting. Sometimes your symptoms continue despite doing everything you can. It may mean you need medication adjustments or other treatments. As heart failure worsens, you may experience more time in the yellow zone, and it may become your baseline. If you and your doctor have been working to improve how you feel, then you will need to understand your new baseline, which is how you feel on your good days. Continue to follow the zone tool, knowing that you may have yellow zone symptoms at baseline, but if they increase or worsen, then you should contact your doctor.
What is the effect of exercise on heart failure?
Staying active and exercising regularly is an important part of living well with heart failure. Before starting a new exercise program, talk to your cardiologist or primary care doctor about the types of activities you would like to do and how to stay safe while exercising. If you're not sure you can safely exercise, ask your doctor if you qualify for cardiac rehabilitation or physical therapy services. The research has shown that adults living with mild to moderate heart failure symptoms benefit from staying active and exercising regularly. When designing your exercise program, consider the activities that you like and the four main areas of physical fitness: endurance, strength, balance, and flexibility. By doing exercise that incorporate all four areas of physical fitness, you'll find that you move better and feel better. For more information on staying active and exercising, check out the following links.
What is the best exercise for me?
Regardless of your physical fitness level, all adults can benefit from moving more and sitting less. The American Heart Association and the Centers for Disease Control recommend 20 to 30 minutes of moderate intensity aerobic activity most days of the week, 2 days or more of moderate intensity strength training, 3 days or more of balance activity, and 10 or more minutes a day of stretching. If you cannot tolerate 10 to 15 minutes of continuous walking, consider using a stationary exercise machine or buying a four-wheeled walker so that you can take seated rest breaks as needed. When starting an exercise program, set goals, keep an activity log, and share your successes with family, friends, and your doctor. Keep moving and enjoy your life fully.
I've heard my doctors use the terms ejection fraction and cardiac output. What do they mean?
Ejection fraction, or EF, refers to how well your left ventricle pumps blood with each heartbeat. The left ventricle is the heart's main pumping chamber, and it is responsible for pumping blood into your aorta and then out to the rest of your body. The ejection fraction is reported as a percentage of the blood being pumped out of the left ventricle each time it contracts. The normal range of an ejection fraction is 55 to 70%. When an ejection fraction is below this normal range, this is considered heart failure. Ejection fraction can be measured with an echocardiogram or an ultrasound of your heart. Another term that you may hear mentioned is cardiac output. This is a calculation of the amount of blood your heart pumps, measured as liters per minute. Cardiac output and ejection fraction are measurements that your cardiology team will use to better understand how well your heart is able to supply blood to all of your vital organs. When we find that your ejection fraction or cardiac output are low, we may need to start you on new medications or adjust the doses of your current medical therapy. There are cases when the severity of heart failure progresses to the point that medications alone can no longer provide enough support to maintain sufficient heart function. This is called advanced heart failure. There are subspecialists within the cardiology team that focus specifically on management of patients who have advanced heart failure. In some of these circumstances, an advanced heart failure provider may discuss advanced heart failure therapies, which would include mechanical devices that support the function of your left ventricle, or even heart transplant.
Why are you prescribing blood pressure medications when my blood pressure is normal? Will I always have to be on these medications?
While some of the medications used to treat heart failure are also used to treat high blood pressure, the main benefits of these medications, as shown in clinical trials, is to make people feel better and to live longer. Given these benefits, your heart failure team will strive to increase the doses of these medicines to the effective doses shown and proven in clinical trials.
These may include medications like metoprolol, carvedilol, lisinopril, losartan, Entresto, and spironolactone, though you may be prescribed others. Studies have shown that these medications have the greatest benefit at the highest tolerated doses, or the target dose. Your cardiology team can review the target doses with you and likely recommend gradual increases of these medications, even if your blood pressure is well controlled, so that you get the greatest potential benefit. With these medications, it is possible that your ejection fraction may even improve. The ultimate goal of using these medications is to try to slow the progression of heart failure, help you feel better, and reduce your risk of bad outcomes.
When is my blood pressure too low? And when it gets that low, should I still be taking my blood pressure medication?
As we've discussed, we often recommend increasing the doses of many heart failure medications to the highest tolerated doses. Because these medications are also commonly used to treat high blood pressure, your blood pressure may get rather low, maybe even lower than what you are used to. It is helpful to monitor your blood pressure at home regularly, and it is always best to discuss specific recommendations with your cardiology team, but what defines a blood pressure that is too low is different for everybody. If you are having symptoms of low blood pressure, such as feeling dizzy, lightheaded, feeling as though you may faint, or fainting, then your blood pressure may be too low. If you are concerned about the safety of taking your medications, and especially if you are having symptoms, you should call your cardiology team for advice.